let's start the journey to understand what a fissure is. Our body is supported with the help of the spinal cord or the tailbone. This tailbone ends with curvature and the anal canal follows the curvature and hence its last part is curved too. If a hard motion is passed or unusual force is applied, it is the inner wall of anal canal which gets compressed between the hard surfaces, which is backbone and the hard stool. A cut develops which is known as fissures. Fissure is of two kinds. It is either acute or early and chronic or prolonged. How do we treat a fissure? The time period of suffering is necessary to note which decide the type of treatment a patient needs. Acute fissure is within 6 weeks and is treated easily through ointment, stool softeners and other medication. Our human body works on a balance and in order to deal with a fissure, the body reacts on its own after 6 weeks. In chronic fissures, a vicious cycle develops. The body increases pressure, which is 18 to 20 times more than usual. This leads to a shutting down of anal canal, which further leads to problem with the wound not healing, decreases blood supply which implies non-healing wound and then again pressure increases followed by the same cycle. This leads to constipation and eating less which is unhealthy, also too much pain and burning with the bleeding sometimes while passing motion. One of the oldest methods is anal dilatation, which works towards relieving spasm under anesthesia by the forceful dilatation. The result is 100% cure of the symptoms, but there is high possibility of damages done to the anal area of the patient, so they lose control over their bowels. Therefore, worldwide, anal dilatation has become outdated, which in reality has not stopped 90% of the doctors from still using it as treatment. Bangalore Smiles tries to approach this differently by keeping the patient's happiness in the long run in mind. We use the same principles for surgery, but we are unique as we apply lasers to carry out the procedure. The fissures is entered and laser fibers are used to make a small cut in the sphincters which opens it out. The spasm is released and the blood supply starts making the medicine more effective, thus leading to a complete healing.